Hello, everyone. I'm Leslie Wunstall, the Education and Awareness Coordinator at Dysautonomia Support Network, and you're joining us today for Discovery Education, where experts within their field help our community learn how to thrive. Now, be sure to like, comment, and subscribe to our channel to get more videos and information on how to live your best life with dysautonomia. Now, last month, we had Dr. Kevin Lasko with us sharing about some of the central control mechanisms of the autonomic nervous system and how, as a chiropractic neurologist, he uses different neurorehabilitation exercises to specifically target where dysfunction is occurring in the autonomic nervous system and brain to then improve symptoms and quality of life. You can catch up on these episodes by visiting our Discovery Education playlist. Now, today, Dr. Lasko is back with us as promised to answer some of your questions. Again, Dr. Lasko is a board certified chiropractic neurologist in Pennsylvania. He's a fellow of the International Academy of Chiropractic Neurology and has obtained certifications in childhood neurodevelopmental disorders, functional imaging and anatomy, movement disorders, and most recently, the treatment and diagnosis of dysautonomia. Dr. Lasko is a presenter for the Ehlers-Danlos Society Project ECHO and has significant experience in treating complex patients with Ehlers-Danlos Syndromes, dysautonomias, Chiari Malformation, Mast Cell Activation Syndrome, and more. So thank you for joining us again today, Dr. Lasko.
Oh, it's my pleasure. Thanks for having me.
All right, so we'll start out with one of the most frequently asked questions, and that is, how can I find a provider like you? It's a question that we commonly get, as not many medical providers are knowledgeable about diagnosing and treating dysautonomia.
Yeah, I've taken a lot of calls from the previous sessions that we did and emails and whatnot. And that question does come up quite a bit. Um, I think the the title of the provider isn't really the big thing. I think it's the understanding that you have to look at these central control mechanisms and understand how to evaluate them and how to target them with very specific treatments or therapies to get the correct autonomic response that helps improve how that system's functioning and ultimately how the person can function in life. So I think that's the biggest thing, because there are people like myself that might not exactly target the autonomic nervous system. They may go into more sports and things like that. So you really have to be, I just think finding somebody who really understands those central controls of the autonomics is really, really important.
So in other words, just like, regular neurologists that we have, they can specialize in movement disorders or epilepsy, migraines, anything with the nervous system. So with chiropractic neurologists, some specialize in sports medicine concussions. You happen to specialize in autonomic dysfunction, and then those that have Ehlers-Danlos syndrome. So talk to me a little bit about that and the understanding that a provider might need to have in that interconnection between EDS and dysautonomia.
Yeah, that's another really good question with this, because you don't necessarily need to have Ehlers-Danlos to have a dysautonomic problem. But my experience has been a lot of EDS patients have that component under their umbrella of all the comorbidities that they do have. And treating an EDS patient is a different, I would say it's just a different animal because of the interconnection of the soft tissue problems and the connective tissue problems and how that affects the how the brain is actually wired and how it functions. Because going back and kind of reiterating some of the things we already went over is, if we're sensory driven, which we are, our brains form based on the input that it gets. um, EDS patients move a little funky at times,
Right.
right? They move too much, and I think that alters the sensory input that ultimately gets into the brainstem all the way up to the frontal cortex, prefrontal cortex, and that alters how those connections are kind of made. and then ultimately how the system controls your autonomics or how you move or things like that. So I think that EDS component is really important to have a good understanding, because one, you have to be, I don't want to say careful, but you have to have a good understanding of that, because um, I don't think you could treat them like myself, who does not have EDS. You really have to understand what it's about, where some of the problem areas might be with those patients, and ultimately, if they're moving too much, how much more motion do you want to put into joints and ligaments and stress those areas? So, I mean, that's just how I practice. But yeah, you really do have to have a good understanding of EDS, the comorbidities, and just what you're dancing with when they come into your office.
So, in other words, it would be, if there is a chiropractic neurologist near me, taking the time to ask them those questions of how well they understand dysautonomia, maybe some of the success stories of different patients that they have. But then also, if I'm hypermobile and have EDS, asking them about that connection. And if it's something that's more just blown off, then it maybe just be a little bit more potentially cautious about that because of that important interplay. If I have too much movement within my neck, then that can potentially impact, how I might respond to some of the treatments compared to a person with dysautonomia that does not have Ehlers-Danlos syndrome.
Exactly. And our community is not immune to not understanding EDS fully. It's not like any other. I mean, it's like any other discipline that's out there. Some understand it, some don't. Some some really don't think it's that big a deal. So you just have to be careful.
Definitely. So, another question that we've gotten is questions about how your program works. I know that there are different approaches with some patients, being seen on multiple days a week over a longer period of time. But how does your program work?
Personally, what I see or how I see patients is we always kind of, I don't want to use the word screen, but we have a conversation with them beforehand. Usually they send me a symptoms list or a diagnosis list. I go over it. We schedule a phone call with them, usually 20 or 30 minutes. Some of them run a little bit longer. That's fine. But I try to tell the patients what I think I can help with and what might not be in my wheelhouse. So when they do come here, if they decide that they do want to come here, we're all on the same page what we're kind of looking to get out of the care. And once they come here, I've just found, I've played with this for years, and I've just found that either a 3 or a 5 day treatment is usually what I, after seeing the patient's history and all that, I would tell them I think you'd be good for a 3 day or a 5 day treatment plan. And I'm with the person anywhere from 3 to 4 hours a day straight. And in that time frame, we do examinations, we do treatments, we see if we're getting the right response. And we literally look at, like we said in previous issues here that we were talking about, I look at from brainstem all the way up to the prefrontal cortex just to see where in that system is not connecting and functioning correctly. And over a course of 5 days, we target those areas. We try to give very specific exercises to that person based on their neurologic findings.
Mhm.
We make sure they understand how to perform the exercises. If a significant other is there, we make sure they know how to do them, because some of them you will need a little bit of help with. And usually by the end of that week, they may walk out of here with 30 different exercises, 25, 35 different exercises that have shown that they improve how your autonomics work. And I always tell them if it works in Quarryville, it'll work in New York, Maine, Vermont, Minnesota, wherever you're from. The big thing is you just have to be diligent and do the exercises. It's not like you have to join Gold's Gym or Planet Fitness, but you just have to be religious in doing these exercises. And once they're gone, we do have follow-ups, like if they have questions, sending an email, if I can answer it during an email, or with an email I do. If not, then we have just a quick phone call to say, hey, you're doing this great, why don't you try this if you're struggling with certain things. So once you're gone, you're not gone, you're just back home, and we still have contact.
Awesome. That's great to hear. So another question that we got is, does insurance cover this kind of treatment?
The answer is I don't know, but what my wife did was, after seeing patients for a while, we give before the patient starts, we give you the general billing codes that we use to bill the insurance, and we'll give you the codes. You can call up your insurance and say, hey, if these codes are used, will there be any reimbursement, or that. My wife gives you all the receipts and the super bill and all of that, and then you submit it to your insurance for any type of reimbursement. And
Right.
we have had some that got reimbursed very, very well. We have others that, of course, didn't. So that's kind of up to the insurance company, though.
And I think a lot of that does depend on just the type of insurance that individuals have. And oftentimes, your services would be covered as potentially an out of network provider because you are in network with any insurance company, correct?
Correct. I am not just, and that's just because we see patients from literally all over the world. And it's so hard to know what the insurance company in California needs, and Maine and Florida. So we try to give very general codes so that generally be covered if you have either chiropractic coverage or physical therapy coverage, because some of the codes are physical therapy codes. So if you have one of those two coverages in your insurance, there should be some coverage there.
Yes, and that just depends, for those of you guys that are listening, of doing that due diligence and checking out with the insurance company beforehand to see what might be covered or what might not be covered. Another question that we've gotten has occurred largely due to the pandemic, and a lot of us during the pandemic saw a lot of our providers virtually. So, can this type of treatment for dysautonomia be done virtually?
I wish it could, but with the way I treat patients, it's really difficult to see what's going on in the entire body on a camera. Like you could see me from basically shoulders up. I've done exams or have done therapies, and with their arm, and their left foot is twitching or it's moving when it shouldn't, or eye stuff, and their hands going into like a flexed posture. So it's really hard to. I wish it could, but I really need to see the person in front of me to see how they respond to what I do. And it really gives me a good window into looking at how much they can do. Like I always say, how far can you go, and when do you have to whoa, you know? And you really need to know that when treating things like dysautonomia, because you don't want to exceed that limit of the system that you're actually trying to help.
Right. So, we're going to switch gears a little bit and talk about what kind of training and education that chiropractic neurologists go through that help prepare you for this role.
Sure. So we do undergraduate studies at a local college or wherever you go to. You go to chiropractic college for around 7.5 years. Okay, the in total, those two would be about a 7.5 year program, and then the chiropractic neurology portion of that is basically like a postgraduate um, education. You do There's different boards, but so many have so many hours that you have to take. You have to pass the certification board, and then you get your diplomat status, and then you have to keep up with so many credits a year of continuing ed to keep that status going forward.
So chiropractic neurologists, they are board certified by the states. There are strict criteria and standards that you guys have to adhere to maintain that license to continue to practice.
Correct.
Thank you.
Mhm.
So the next question comes, can you diagnose dysautonomia? We've talked a lot about how you treat it, but if a patient has come to you with not having a diagnosis at all, are you able to diagnose the condition?
Sure. Yes. I mean, that just comes out of the examination. Um, there's different, obviously, dysautonomia, big umbrella of stuff, but yeah, I mean, that's a dysfunction, technically a dysfunction of the autonomic nervous system. So if you're having problems with the autonomics, technically that is a dysautonomia. So yeah, that you could definitely diagnose. The teasing out is things like the orthostatic side of the dysautonomia, gut problems, tissue delivery or blood delivery to your tissue problems. That's when you start really honing in on what is the dysautonomia effect on the rest of your body.
And so, if you're seeing that it's potentially going down the lines of a specific type of dysautonomia that may require diagnosis, you have referrals that are able to help the patients be able to find providers to be able to get the more specific diagnoses with additional testing and things like that.
Yeah, I work with a lot of cardiologists, thoracic surgeon type of people that are looking at like peripheral neuropathy type of things, different neurologists. Yeah, so we have a nice, it's a network, if you will, um, of people that we can call on if we need help.
All right, so now we're going to get into some more specific questions related to some certain treatments and how they might impact the autonomic nervous system. So, one of the questions that was sent was how would biofeedback fit within chiropractic neurology?
I think it I think it fits. I just think the patient has to be ready for it. Meaning, and as you know from the past two episodes here, I might use some different examples, but you your body has to be ready for any type of treatment. I don't care where you're getting it from, especially with, and I'm just going to kind of do a big, if you have EDS and dysautonomia with maybe you're a little tacky, you have some GI issues, hands, feet cold, maybe a little brain fog, like you have to make sure that you're treating the person at the right time with the right treatment. Meaning, we had a little grandson recently, and he had two arms, two legs, but just because he had two legs at 2 months, we didn't put him down and say walk.
Right.
He wasn't ready for it, and that's something that I have found over the years of doing this with EDS dysautonomic patients is I think most of them are having the right things done to them. Like everybody knows exercise is good. We all have to get up. We're humans. We have to get up. We're vertical. We want to move. If we're moving, that makes us social. That helps prefrontal areas and all that. But you have to be able to stand up and maintain a decent heart rate and have good motor patterns before you can start walking. Because if you kind of skip those first two steps and just say, hey, I know you're resting, your heart rate is 100 beats a minute, we gave you a beta blocker, it's down to 80, we're just going to get you on a treadmill and just walk, and you still march with same arm, same leg,
Hmm.
that system is not going to calm down because you are doing something that is like algebra and you're talking to a kindergarten kid. So that's just how I look at it. I always look at the autonomics first and then like motor patterns and reflexive systems and then build from there. So back to the like biofeedback, neurofeedback, I think it's a part of it, but the person has to be ready to do that. And the way that frontal cortex, prefrontal cortex gets developed is by good sensory input, appropriate sensory input. And most EDS patients and just they don't have great sensory input because they move kind of
Wonky.
wonky. So you really want to try to get as much good sensory input in before you start dabbling in things that are like prefrontal exercises.
So it would be a therapy that you may potentially use, but maybe not right away, just within
Sure. Yeah, I agree with
the.
that. Yep. Yep.
Okay.
Mhm.
So the next question that we have, and it's our final question, is can metronomic breathing be used in those with dysautonomia to help alter parasympathetic tone? And then how exactly does that work?
Yeah. Again, this is kind of like the biofeedback question. I think yes, but usually, um, and we do this with every patient that comes in. Like we monitor what their heart rate does when you breathe, and you if when you take a breath in, that will generally activate your sympathetics. When you blow out, it should activate your parasympathetic. So if you're monitoring the heart rate, you should see some variability in that heart rate as you're doing maybe a minute's worth of breathing in and breathing out, like 3 seconds in, 4 seconds in, 4 or 5 seconds out. You should see your heart rate change. Well, if you don't see that, doing more breathing might not be the best thing to do until you could change how that system turns on and off.
Okay.
Does that make sense? Like um, if you're doing the metronomic breathing and the heart rate goes from say 85 beats a minute up to 90 when you breathe in and only goes down to like 87 when you exhale and goes up again when you breathe in and doesn't come down, you need to get that system to kick on first before you can do that type of breathing and get the result that you want. And that comes into that lack of inhibition
Okay.
that we talked about before, because it has to be an on-off switch for you to breathe and get the correct result from it.
So what's the
It's
difference
good, but it has
between,
to be ready.
right? So what's the difference between metronomic breathing and just like regular breathing for those in our audience that might not understand?
Yeah, I mean, it's breathing to a tone. It's breathing the way I do it, and I hope this is what you're telling. I set a tone pace that the person should breathe to. You breathe in and out in this time frame, and you hear two tones, and you try to take a breath in and blow all the way out. Um, and that's what we look at. One of the first things we do to see, are you getting the correct response from when you would breathe in this manner? Regular breathing, especially with this group that we're talking about, they don't exhale very well. Like they almost pant. Like I see a lot of the dysautonomic patients that I see, their respirations are super high because they just don't have that good pattern. And again, I think it's that on off switch, that lack of inhibition that doesn't let them breathe in a correct manner. So if you're inhaling more than what you're blowing out, you're already kind of biasing yourself to more fight flight versus rest and digest.
And so then through some of the other exercises that you can prescribe, you can help activate that parasympathetic system even before doing breath work to be able to make the breath work more effective when it is used.
Yeah, can we figure out how can we activate the respiratory centers in that brainstem so they can turn kind of each other on and off,
Mhm.
and then get the correct response that you want from a sympathetic parasympathetic output. And yeah, I mean, I saw that today with the patient today. She didn't have very good uh, variability when she was breathing, but by the end of the day, she was having a 10 to 12 beat difference.
Mhm.
Go do metronomic, that's great now. But if you did it before, you might be poking that bear because you're not getting the right response that you're hoping for.
Right. Awesome. Well, I know I've definitely learned so much from you through all of these talks and just really understanding more about how our autonomic nervous system works, and the central control mechanisms there, and just that different approach and a way of tackling dysautonomia that's individualized to each patient. It's looking at how they are responding with all of their conditions and being able to then target specific therapies to be able to help improve symptoms as the patient's ready for it. I so appreciate you coming today, answering these additional questions. They certainly give us insight into more about how your program works, how this all works, the different education that's required to really become an expert within this field. We certainly need more experts like you to be able to help patients. I wish we had a clone button for so many different medical providers to be able to help so many more. So thank you so much, Dr. Lasko, for answering these questions. I hope that they were helpful for our audience. Now, if any of you guys have additional questions, please reach out to Dr. Lasko at lasko.hemispheres@gmail.com, and then he will set up a time to call and talk to you about your questions. Also, be sure again to like, comment, and subscribe to our channel for more videos on how to live your best life with dysautonomia. So thank you, Dr. Lasko.
Thank you very, very much.